Hi, I'm Dr. Castanet. Today I'm going to talk to you about degenerative disc disease. I'm going to use a couple of models to describe the process. This is a model of the low back. These are two lumbar vertebrae, or low back vertebrae. This would be the back of the person. These are the bony prominences you can feel if you touch the back of your spine and run your finger up and down the spine. These are the vertebral bodies in front. This is a disc in between the vertebrae. This is another disc in between. If you look at it on end, I'll turn it up. This is the top of the disc in cross section. There are two components to the disc. There's the nuclear component, the nucleus pulposus. It's got a consistency like crab meat. It imbibes water or holds water in it, and it provides, when there's compression on this, from being upright, sitting, or standing, then the pressure on this is distributed to the outer rings, or the inner rings of the disc. These rings here are tough fibrous connective tissue. They're at an oblique angle, and there are 12 to 25 layers of these. So, for example, starting from the innermost part to the periphery, the fibers of the disc would be oriented like this in an oblique angle. The next layer would be like this. The purpose of this design is to provide a tough, fibrous, consistent consistency that will contain this inner part. It does a pretty good job, and these discs are subject to tremendous loads from the time we're little kids throughout our lifetimes, from everything from sitting, standing, bending, lifting, walking, running, jumping, carrying, you name it. There are a lot of loads imposed on these discs. These discs are present from the bottom of the skull all the way down to the tailbone. Some are more modified, and some are non-existent in the very uppermost neck, but for the most part these discs exist between all the vertebrae from the neck down to the low back. They do a pretty good job, but they're not perfect. Over time, degenerative changes start to happen on a microscopic level. This generally starts as we're children, and it's a function of, again, all the loads. The innermost part of the disc does not have nerve sensation, so you don't feel damage that's initially occurring. You don't typically feel back pain until you're in your 30s, 40s, or later. The peak incidence is at the 40s. The degenerative process starts with loss of water content, and there are certain markers of degeneration, certain molecules that have been measured and quantified. There are also molecular markers of regeneration in the disc. There are also cells that live within the disc that have to synthesize the reparative molecules. Over time, as the degenerative process proceeds, the environment within the disc becomes poor, the pH becomes more acidic, cells within the disc that are responsible for synthesizing more molecules die off, and those that remain make fewer of the reparative molecules. So this degenerative process over time will result in a change in the signal or appearance on an MRI scan, so that you get increased or decreased T2 signal rather. That's not important for you to know necessarily, but the appearance will change. Discs then, when the outer rings become incompetent, they will permit this inner part to migrate out towards the periphery. They typically go back this way and can hit the nerves on the side and the nerves that are going down the canal here, giving rise to pain in the distribution of that nerve. The most commonly involved nerves are the nerve roots that make up the sciatic nerve. You then can get pain down the distribution of those nerves, the most common of which is sciatic nerve pain, which is typically felt in the buttock, and then the thigh, and then the back and side of the leg below the knee, and it can involve the side and bottom of the foot. If you look at an MRI scan, in addition to seeing the decreased color content here, You can also see that the disc will start to collapse, kind of like a flattening tire. And also the bones, which are very vascular and which have all the nutrition that has to migrate up and diffuse into the discs above and below to provide the nourishment for the discs. These bones, when the cushion of the disc isn't effective, these bones then become stagnant in terms of the circulation back and forth through the disc. They will change color also, and they will become white in color from the stress. We can see that on the MRI scans. We call those changes modic changes. So lots of nasty things happen as a result of the initial changes and subsequent progressive degeneration of this disc. As it collapses, it affects the bones here in the way of the circulation. These bones then also become deformed. It also puts more pressure on the joints back here, which determine the angles at which we bend and turn. They're made to bear more weight than they're intended to because of the collapsing, progressive collapse of the discs. These then enlarge, become a source of pain as well. And ligaments between the vertebrae and the back here can also enlarge and collapse and then buckle in towards the canal. This canal is what houses and permits passage of the nerves that have to run from the brain down the spine to the entirety of the body, including down the legs. So all of these degenerative changes, the collapse of the disc, the deformity of the vertebral body, the deformity and enlargement of the joints here, the enlargement of the ligaments, the buckling in of the ligaments, the bulging or herniation of the disc back here, they all encroach on the hole here where the nerves reside and can then put pressure on one or more nerve roots, resulting in significant pain and disability. Let me show you another model. This represents the degenerative process. If I show you from here, you can see in comparison to this how the bones here have become deformed through the process. If I rotate it on the side, you can see that deformity is represented from the side as well. The disc space here is collapsed as opposed to this disc space, which is nice and high and normal. And if you do that at several levels, as often happens, you can get pain from a variety of sources in the back. So how best to treat the process? Well, the most direct approach to treat this degenerative process is to separate the vertebrae like this. You can separate them modestly but very meaningfully so that the patient gets relief, and you can initiate some microscopic regenerative changes in the disc. If you pull the vertebrae apart, the cells within the disc will find a better environment with more water, oxygen, and nutrients. Those cells will then divide and make more cells, and all of the cells will make more molecules to repair the disc. The disc does not have to repair all the way and doesn't have that potential, but it can repair enough that the person typically will get significant clinical improvement of their pain and disability. It is, in my 28 years clinical experience, the most effective tool I have ever used by far for treating most neck and back pain, including from herniations and pinched nerves. And the way this process works is you place the person on a table, on their back, lying on their back, face up. You secure, using the table, you secure the anatomy to the table, and the table very gently pulls the vertebrae apart to get more water, oxygen, and nutrients in here, and it initiates these microscopic and clinically meaningful changes to the disc to make the person feel better. I think it's the most effective and rational and direct approach to treating back pain from degenerated discs. Degenerated discs, by the way, are only one pathology in the low back. But herniated discs, bulging discs, they are all preceded with degenerative changes to the disc. So treating the disc problems through decompression provides relief and improvement of the disc, whether the problem be degenerated disc, herniated disc, bulging disc, extruded disc, pain from the facets or the joints in the back, which are a source of pain because of this collapsing disc process, pinched nerves, which are pinched and inflamed as a result of the degenerative process. Anyway, that in short is how best to treat disc-related and neck and back pain for the most part. 98% of back and neck pain is as a result of this simple, common, degenerative, progressive process that happens in our spine that starts microscopically from the time we're children and proceeds over the course of our lifetime, too often resulting in disabling pain and limitations in our activities. So if I can help you with your problem, my name is Dr. Castanet. I'm in Decatur, Georgia. I serve Decatur, Tucker, and all of the Atlanta metro area. My number is 404-558-4015, and I'd love to be able to help you with your problem. Thanks very much. Bye-bye.